Hello, my name is Mary. I'm an advocate here at Disability Rights, South Carolina, DRSC, formerly known as Protection and Advocacy for People with Disabilities, PNA. DRSC is a nonprofit organization that advocates for the rights of people with disabilities in South Carolina. We can help you understand your rights and advocate for yourself in areas such as employment, education, and access to your community. DRSC provides services to all ages and all disabilities, and our services are free. This video is the first in a series about effective communication and the rights of deaf and hard of hearing in hospital settings. This video will provide a general overview of various laws that apply to rights of individuals with deaf and hard of hearing in hospital settings. The content of this video does not constitute legal advice. We hope the information included in this series will help you better understand your rights and how to advocate for effective communication in these settings. If you have questions related to your specific situation, contact us with the information provided at the end of the video. There are 3 federal laws that apply to effective communication in hospital settings. Which law applies to your situation depends on facts related to the hospital. The first law that addresses effective communication is the Americans with Disabilities Act, also known as the ADA. The AADA applies to both state-run and private hospitals. Under Titles 2 and 3 of the ADA, medical providers, doctors, and hospitals are required to provide auxiliary aids and services for deaf and hard of hearing patients and companions to provide effective communication. Auxiliary aids and services can include a qualified sign language interpreter or video remote interpreting, VRI. The type of auxiliary aid or service required depends on the purpose of your medical visit and the expected complexity or length of the communication required. We will discuss this more in depth in a later video. When using an auxiliary aid or service, it is important that you are able to understand the communication and you can participate in the conversation. Communication should be just as effective as communication with others. A medical provider should not charge you for providing an auxiliary aid or service. The second law is Section 504 of the Rehabilitation Act. That applies to hospitals that receive federal financial assistance. Most hospitals, doctor's offices accept Medicaid and Medicare. That is federal funding. Hospitals under Section 504 cannot exclude deaf and hard of hearing from their programs or services by not providing required auxiliary aid. The third law is Section 1557 of the Affordable Care Act. the ACA, that prohibits discrimination based on disability, and it also addresses effective communication for patients and companions in medical settings. If you feel your rights have been violated or you've been discriminated against, contact us. When you contact us, here's what to expect. An intake specialist will take a brief summary of your concerns and what's going on. We will keep that information so we know what's happening with the deaf community and the problems you're facing. At the timing of this video's release, we have deaf staff available who can complete intakes. If you prefer that person for an intake, simply ask and let them know you prefer an ASL intake. That person will contact you when available. Your information will be reviewed to determine how DRSC can help. We can provide many services: information and referral, self-advocacy assistance, training, direct representation, and advocating for policy change. Many variables go into making that decision. For example, what type of problem you have. If we have staff available, and if we have funding available. Our main goal is to teach individuals how to advocate for themselves so they can use that skill in the future. Please understand, unfortunately, we do not have the staff or funding available to directly assist in every situation. If we decide to provide direct assistance, your information will be given to a staff member who will contact you to get more in-depth information. Understand, we require constant communication in order to help you. We cannot speak with you one time and then proceed. It is very important that you maintain constant communication with your attorney or advocate. How to contact Disability Rights South Carolina. You can call us using phone number 1-866-275-7273. We also have a T2I phone number if you need. That number is 1-866-232-4525. Last option, you can email us at info@disabilityrightssc.org.